हेलो स्टूडेंट, तो हम कर रहे थे एंटी न्यूप्लास्टिक एजेंट। सो फार हम लोगों ने कैंसर कैसे होता है, टाइप्स ऑफ कैंसर पढ़ लिए थे, एग्जांपल्स पढ़ लिए थे, क्लासिफिकेशन ऑफ कैंसर, ट्यूमर ग्रोथ साइकिल पढ़ लिया हमने, डिफरेंस की नॉर्मल सेल साइकिल और उसमें क्या होता है, कॉसेस क्या होते हैं वो भी हम लोगों ने पढ़ लिया। एंटी न्यूप्लास्टिक एजेंट डेफिनेशन कर ली थी हमने। और उसके बाद नेक्स्ट हमने किया था कि कैंसर डायग्नोज कैसे होता है, ट्रीटमेंट क्या है डिफरेंट कैंसर्स के, कैंसर्स की क्लासिफिकेशन, उसकी क्लासिक एंटी कैंसर एजेंट्स की क्लासिफिकेशन कर ली थी हमने। So now today in today lecture we are going to start with first class named as alkylating agent। तो उसके बारे में हम पढ़ेंगे। तो यहाँ पे कि कैसे अल्काइलेटिंग एजेंट काम करते हैं वो दिखाया हुआ है कि वो क्रॉस लिंकिंग को क्या करते हैं, इनहिबिट करते हैं, जिसकी वजह से रेप्लिकेशन नहीं हो पाती है एंड अल्टीमेटली सेल डेथ हो जाती है। तो ये पिक्टोरियल फॉर्म है जो दिखाया हुआ है, ये पिक्टोरियल फॉर्म क्लासिफिकेशन ऑफ एंटी कैंसर ड्रग। So this is the different stages of cell cycle। The GIF file showing how the cells are divided from one to another in different phases. So neoplasm, neo means new, plasm means form. In medicinal terms for cancer or a tumor, which means relatively autonomous growth of tissue, a cancerous tumor is a malignant tumor of a potential danger. Cancer is not one disease, but a group of diseases affecting different organs and system of body. Numerous different forms of cancer possess certain common features. It is a disease characterized by excessive cell proliferation. It is generally results in tumor. Tumor cell lateral lose the appearance and the function of tissue cells from which they are arise. Tumor cell not only expand in size but also invade surrounding cells. When nerve endings are affected, pain is experienced. The cells can be detached themselves from the parent tumor, move to the another location, and new cancerous growth is established. This is called metastasis. A cancer cell that arises from the mesodermal cell, which forms bone, muscles, cartilage, and related tissue, is called sarcoma. If it is arise from endodermal cells, which is from intestinal and is associated organ and ectoderm cells, which from skin and appendages and the nerve tissue, then it is called as carcinoma. A tumor developed from all three embryonic layers is called teratoma. Leukemia and polycythemia are the types of blood cancer. Cancer is more difficult to cure than bacterial infection because of two reasons. Firstly, bacterial cells have distinctive cell wall and their rhizomes are different from those of human cells. Whereas in case of the cancer, this doesn't happen. The cancerous cell wall and the rhizomes are similar to the normal cell. However, the difference between normal and neoplastic cells are merely quantitative. Next, include the immune mechanism and other host defense play an important role in killing the cell because it acts as a foreign body. But in case of the cancer, it is not act as a foreign body. Therefore, the killing or the role of the immune mechanism doesn't play here. Then there are the 7 warning signs of the cancer abbreviated as caution according to the National Cancer Institute, in which C stands for change in bowel or bladder habitat. A stands for a sore throat that does not heal. C stands for unusual bleeding or discharge. T stands for thickening or lumps in the breast or elsewhere. I stand for indigestion or difficulty in swallowing. O stand for obvious change in body or mood. N stand for nagging, cough or hoarseness. Cancer, cancer chemotherapy began in 1940 when tilbestrol phosphate was introduced for treating cancer named as prostate cancer. This is followed by the use of the nitrogen mustard in the treatment of malignant lymphomas. The folic acid antagonists were used to treat childhood leukemia. Chemotherapeutic agents are used where tumor is inoperable or where the metastasis occurs. Surgery is preferred where the tumor is well defined and accessible. Radiotherapy is a superior to chemotherapy as it effectively destroy a tumor with the minimum damage surrounding cells or the tissue. Drug use, the treatment of neoplasms are called anti-neoplastic agents. The most preferred classification is based on the mode of action. ये हम लोग पढ़ चुके हैं पहले. So today we are going to start with alkylating agents. So, what are alkylating agents? Biologically, alkylating agents bring about alkylation of certain nucleophilic groups. Means जो कंपाउंड होंगे उसमें कोई ना कोई न्यूक्लियोफिलिक ग्रुप होगा, जैसे कार्बोक्सिलेट होता है, फॉस्फेट आयन होता है, थायोलेट आयन होते हैं, ये होंगे. तो ये क्या करेंगे, वहां पे इलेक्ट्रॉन पे जो आपका फ्री इलेक्ट्रॉन होगा उसकी वजह से क्रॉस लिंकिंग को इंडिकेट करेंगे. तो जो फर्स्ट ड्रग हम अगर बात करें वो है हमारे पास क्लोरम ब्यूसिल. क्लोरम ब्यूसिल इज एन aromatic nitrogen mustard which is effective orally. It is slowest acting and least toxic anti-neoplastic drug. It is effective against chronic Chlorophyll is an aromatic nitrogen mustard which is effective orally. It is the slowest acting and least toxic antineoplastic drug. It is effective against chronic lymphatic leukemia. Malignant lymphomas, carcinomas of breast cancer, and ovary. It is generally given in combination with other anti-neoplastic agents such as vinblastine to improve activity. So, uh, physical properties include it is a crystalline powder, has slight order, it is practically insoluble in water, but freely soluble in alcohol and chloroform. Chemical properties include the substance is treated with HCl and precipitate is washed with water. The washing then treated with the potassium mercury iodide, a buff colored precipitate is obtained. Chlorambucil is not sufficiently stronger base, the beta chloroethyl amino group does not give cyclic aziridine in iron because electron pair of the nitrogen will be localized on aromatic rings and hence at a physiological condition carbonium ion is formed by heterocyclic fusion. Heterocyclic fusion of carbon and chloride bond. This attack on a nitrogen radical of the guanine of DNA and thus alkylation of DNA happens. Storage, it should be stored in a tightly closed container. It is used to treat Hodgkin disease, chronic lymphomatic leukemia, malignant lymphomas, ovarian cancer, breast cancer. It comes in a tablet formulation and this is a brand name. Next drug includes mitomycin. Mitomycin, it is a blue violet crystalline powder soluble in water and in polar organic solvent. It is stable at room temperature but affected by air and light and it is stored in tightly closed container and light resistant container. Uses include it used for the stomach cancer, breast cancer, bladder cancer, lung cancer, cervical cancer, and it is also used to treatment of the pancreas, colon, soft tissue sarcomas, and carcinoma. When we talk about the formulation, it comes as the injection, and this is a brand name. Next drug includes Next drug includes cyclophosphamide. Cyclophosphamide occurs as a fine white crystalline powder. It is odorless and has slightly bitter taste. It is soluble in water, very soluble in alcohol, but slightly soluble in ether. Its 2% solution has pH between 4 to 6. When we talk about the properties of the cyclophosphamide, its aqueous solution is boiled with a silver nitrate solution a white precipitate is obtained. It is oxidized in liver to give phosphoamide mustard with loss of acrolein. Stability it is decriminalized on exposure to light and unstable at temperature 30 degrees and hence it should be stored in tightly closed light resistance container. It is used for the different types of cancer such as breast cancer, cancer of ovary, lung cancer, neuroblastoma, and it comes as injection and tablet. Next drug is cisplatin. Cisplatin, it is a planar structure. C isomer is biologically active, but trans isomer is inactive. It forms complex in bidentate way with the nitrogen of 2-guanosine residues of DNA strand. It is formed in intrastrand DNA cross-linking. It reacts with thiol groups on protein and thus produce toxic effect. It is white lyophilized powder. It melts at 200 degrees 7 Celsius. It is slightly soluble in water and sparingly soluble in dimethylformamide, that is DMF. It is stored in well-closed container. It is used as metastatic testicular sarcoma, metastatic ovarian carcinoma, advanced bladder carcinoma, cervical, head, neck, and small cell cancer. It counts as injection. Thank you. I hope this video is informational for you.